So why do you think we have a healthcare crisis in America?
You know, it's very interesting. I want to always start with this place that I have lots of colleagues that I respect as physicians, and I have lots of colleagues that really intend to do the right thing. They want to help their patients, but I believe that philosophically, medicine has been built on the wrong foundation. And when you build on the wrong foundation, you know, you can build a tall tower, but if the foundation is weak, the tower is going to begin to tip, and that's what we're seeing even now. There's, you know, not to go too far down the road, but philosophically, medicine was built on the wrong foundation, where we started with a theory and we used the facts to prove the theory. And the difference is empiricism is that we have a theory, but we allow the facts to modify the theory and to change the theory. And it's ultimately the facts that create the theory rather than the theory creating the facts. And so we had a theory, a foundational theory of medicine, that it is created by cellular dysfunction or biochemical dysfunction that we can fix with a pill, or that we can fix with a surgery, or that we can identify with a test. And we've built the entire scope of medicine on that foundation. And it prohibits us from looking at the global part of the human body, looking at the body in context, understanding how all the systems work, and understanding the complexity of nutrition, that we can't reduce it down to its component parts. We can't compartmentalize a part and just fix that one part without having some impact on the remainder of the body. And so that I think is the philosophical underpinning of medicine that has led us to this place today where we have a healthcare crisis, where we're doing more and more of the same, more tests, looking for more problems, and then using the things in our tool chest to try and fix it, but we can't fix it. And we only identify more problems, and then we only use more healthcare to do that. And so we have a financial crisis, and we have a crisis of people in poor health that have no direction, no hope, no vision. And in fact, you know, one of the things that often doctors say, which I try to tell my patients they don't need to take on, there's a curse. And doctors will often speak the curse into their patients' lives, saying, you know, this is the worst case I've ever seen. You have no hope. This is a degenerative disease that will only get worse over time. You're going to die early. This is a genetic problem that can't be corrected. So we speak these curses into our patients' lives. They take them in and they believe them, and they have no hope. And what happens when we have no hope? We look for something to give us some kind of joy and happiness, and we enter into the world's food system, and we indulge ourselves in the food of today because it interacts on the neurochemistry to give us a little bit of a hit and make us feel better about our current position. So I believe that philosophical underpinning has created this problem today.
So how can we solve that problem?
Part of the solution, I believe, is at the grassroots level. You know, when we've talked about trying to solve the healthcare solution, I believe that if we start at the top and try to change legislation, we could spend a lifetime working to recreate legislation and change the healthcare, and we're going to be fighting against lots of money and lots of power. I believe that the change comes when we begin changing individual lives, both through education of the public and education of the physicians. When the public understands the power of plant-based nutrition and they start asking their physicians, a lot of physicians are going to start inquiring, well, what do I need to know? And we'll create solutions for them. But also, if we can begin educating physicians, they will have the opportunity to influence the public. So at the grassroots level, when we can begin changing the paradigm and changing the thought processes and changing the mindsets, especially of physicians and individuals, I think we will see a monumental tsunami of change.
So of the doctors that you know, your colleagues and people that you've come in contact with, how is this idea having success and spreading to other doctors that you've seen?
Yeah, and that's one of the exciting things that I have seen in the last 4 or 5 years. There's a much greater level of acceptance within the medical community for plant-based nutrition. Many of the questions that people asked about protein and about calcium are being answered very succinctly and more than efficiently in research today. And I think that there's a lot of doctors that are also seeing that their patients aren't getting well and they're looking for solutions. And so my colleagues are more open today than they were, 10 years ago, and I see a much greater level of acceptance, and actually people and physicians seeking out solutions and looking for answers.